Okay, so for this video, we're going to be talking through sexual dysfunction and how I would walk through a client that is having this issue and what I would recommend. So if a client comes in and they say they have resumed intimacy postpartum, or maybe I'm just doing a well checkup and they're saying that they are having painful intercourse. Some of the questions that I might ask is this something new, or have you always struggled with this? Um, are they postpartum? Is there a muscle in that's tight or loose that is having a problem during intercourse that is becoming painful for them? Are they breastfeeding? Are they just really, really dry from breastfeeding, and do they need to add a lubricant? So I would walk through the questions and have them describe what is painful, what spots are painful, when during intercourse is it painful, is it painful during orgasm, is it painful before, is it just painful after? Could they possibly have a yeast infection or vaginal bacterial vaginosis? These are all questions to be asking a client. For a client that is saying it specifically hurts with penetration, then there could be a muscle, especially postpartum, that healed incorrectly. So it's really important to make sure you dive into pelvic floor therapy in the US, and I mean, not in the US, but in Europe and most other countries. After a client is done with their 6-week postpartum care, they go right on to see a pelvic floor therapist. So this is really important information, because in the United States, after postpartum, what happens? They just leave after 6 weeks and that's it. They don't get any follow-up care or any examination of their muscles or anything that could have healed tight or loose during their postpartum recovery. So that's a really big thing to talk through. Things like burning and stinging, those are often yeast or BV related. So maybe doing a vaginal swab, or chatting through what their discharge looks like. Anything like that will give you more information. Let me just make sure I'm hitting all the points. I always want to walk through if they're feeling safe with their partner, if there's any history of abuse, especially if it's a well woman visit and you didn't just go through a whole pregnancy, birth, and postpartum with them. If this is a well woman visit and you don't know them, and you haven't spent the last 9 months with them, really understanding what their relationship is at home, what their past their past um, sexual history is. Am I saying that right? I don't know if I am. Having a full understanding of what their history is, and anything that could be concerning. Is there's history of sexual abuse? Is a history of an abusive partner? Sex often is not fun if you are having sex with someone that's abusive. So, shouldn't be. And if you are, that's a whole nother problem. But yeah, so really diving in and making sure that they feel comfortable with their partner, and it is not, it may not actually be a physical issue, but an emotional issue. So yes, let me just make sure I'm hitting all the points. I think I am. Yeah, and as far as if your client has female genital mutilation, anything like that, that needs to be an examination to make sure that they are able to actually give birth vaginally, and nothing needs to be done to any of their tissues beforehand. With female genital mutation, sometimes they're sewn up too tightly, and having a baby can be a big issue, and sometimes there's scar tissue that can be an issue, which often can hopefully be corrected before they give birth. But if you find this out super, super late, it can be a cause for some concern. So making sure you talk through that with them, making sure that none of my bias is coming through as I'm talking about female genital mutation. mutilation. Sometimes in certain cultures this is very normal, and if you can come across as like, oh my gosh, what did someone do to you, it can actually be very, very startling to them. So making sure that our bias isn't coming in to this conversation is also really, really important. I think it's really important for me. I'm just reading the last part, like my personal reflection on talking through this and some things that I want to better understand sexual dysfunction. I think that there's a lot of shame around this, and I think it's really important to bring it up with clients and make it as like calm and non-judgmental and casual as possible. I think it can give clients a lot of anxiety and a lot of shame to bring up certain things like I'm having painful sex, or I'm in an abusive relationship, or I'm having a really hard time reaching orgasm. Any of those, there's often just so much shame around it. So bringing it up like, oh my gosh, okay, let's chat about this. What's going on? Tell me all the things. And just decreasing the anxiety and shame in their room can be really important for your clients. Okay, I hope I hit all the topics.